Good morning, Ma'am Helen. My name is Josephine Tulay, and for today, I will be performing the procedure in assessing the hair. So, the hair consists of layers of keratinized cells found over much of the body. So, physical assessment on the hair may provide data that may reveal local or systemic conditions or alterations in the client's self-care activities. So let's start with the assessment and planning. So first is to check for the doctor's order. So it is vital to check for the doctor's order because this will help in achieving and maintaining good health. Also, it is useless if the treatment plan and the diagnosis is not followed by the nurse. And also, checking for the doctor's order will determine the need for assessing the hair. Next is to gather the materials needed. So for this assessment, we will be using the clean gloves. So having all the materials complete will help save time and will facilitate the accomplishment of tasks. So let's proceed with the implementation. So first is to identify the client. So this is a form of verification that we are in the correct client. So to start with, we should introduce ourselves first, and then we will ask our client his or her name and birthday. Good morning, ma'am. My name is Josephine Dulay and I am your nurse for today. May I know your name, ma'am? Okay, Miss Ella. So when is your birthday, ma'am? Okay, ma'am. Next is to explain the procedure to the client, why is it necessary, and how he or she can cooperate with the procedure. So, an explanation will provide the client or will reduce the client's apprehension and will promote cooperation. So next is to wash your hands and observe for appropriate infection control procedures. So as of this moment, I will be putting an alcohol, but I've already washed my hands. In the real setting, we should always wash our hands to prevent the spread of microorganisms. So that's why it should not be skipped in any clinical procedures. Next is to provide for client privacy. So consideration for the comfort of the client is very necessary. So we can close the curtains or the doors in order to give warmth and privacy to the client. Next is we will determine the client's history of the following. So ma'am, do you recently use hair dyes or are you curling or straightening your hair, ma'am? Okay. So do you have any chemotherapy, ma'am? Okay. So do you have any presence of diseases, ma'am? Okay. So having these questions asked will help in providing data that may reveal local or systemic conditions. So dyeing, curling, or straightening the hair may damage the hair, and chemotherapy and other diseases may also contribute to hair loss. So now, we will be inspecting the evenness of growth over the scalp. So this is to assess if the hair is in good condition or not, or if the hair is strong or vulnerable. So we will use our gloves. So we'll just fit in our gloves. Okay, so we are all done. So we will now inspect the scalp and hair of our client. So ma'am, are you comfortable with your position? Okay, so I will be inspecting your hair, ma'am. So upon inspection, we will be documenting for the observations. So next is to inspect for hair thinness or thickness. This is to assess if the hair growth received enough vitamins. So we will check the thickness or thinness of the hair of our client. Okay, so we will be documenting our observation. So next, we will be inspecting the oiliness and texture of the hair. So this is to assess if the oil glands responded well to the needs of the moisturizing of hair. So again, we will take note of our observation. So next is, we will note the presence of infections or infestations by parting the hair into several parts, checking behind the ears and along the hairline at the neck. So this is to assess if there are presence of wound infections, lesions, etc. and lice. So again, we should take note for our observation. So next is to inspect the amount of body hair. This is to know the distribution, the thickness, the texture, and the lubrication of the hair that could tell its present state. So we've already taken note of that a while ago as we check on the hair and scalp of our client. For the evaluation and documentation, document the findings in the client's record. This is for legal purposes and for patient's record. So that is all for assessing the hair. Thank you.